first time acupuncture treatment.
Yeah, very first time.
We're gonna do acupuncture and cupping.
Okay.
And we spoke, just so we can let our viewers know, we spoke a little earlier, and you gave me some tidbits about what's going on.
Hmm.
You mentioned some tightness and
Yeah.
achiness in the back,
Hmm.
and you said you kind of make certain movements and it'll spasm up
It
on
can like
you,
twist up on me.
twist up on
Yeah.
you. Do you get locked in certain positions?
Totally. Yeah. I'll get like either locked in a hunch position or I'll get locked just straight laying down.
Okay,
And I
and
have to almost like pull myself out of the bed to actually get up. And then it's pretty painful to get that straightened out.
okay, and
Yeah.
how often does that happen? I think you mentioned like once a month or so.
Yeah, probably maybe a little less frequently if I'm good on my workouts, but it's fairly common, yeah.
It's fairly common.
Yeah.
Okay. So just so I can speak to the camera a little bit, if someone does come in with reoccurring back spasms or back pain like that, there's an underlying issue.
Mm.
There's an underlying issue that we want to make sure we target.
Okay.
It's not just going to be a treatment of, okay, let's treat your back today. Let's get you to feel good. Let's get the muscles
Sure.
to loosen up. There's
Right.
something inside that's going on
Okay.
that's causing this to repeatedly happen.
Hmm.
So we'll find out today,
Yeah, I'm
and we'll
excited.
do a treatment and get you some relief, not only for short term, but also long term.
Absolutely. I'm so excited, Dr. Alex. Thank you.
Yeah, yeah, of course, of
Yeah.
course. Throughout the session, again, as I mentioned off camera, if you
Hmm.
have any questions, any concerns, feel free,
Great. Thank
because I'm
you.
sure if you do, many people out there do
Right.
also.
Of course.
Um, so what we're going to start with is, okay, so we're going to mainly be treating, is it upper, mid, or lower back?
It's kind of the mid.
Mid
Yeah,
back.
right in the middle.
Okay,
Hmm.
and is generally what you feel, is it sharp? Is it stabby? Is it achy pain?
I would say more like a stab just out of nowhere, kind of. And
Okay,
then if I don't move in an odd way, you don't feel it at all. But then the
okay.
moment you twist, or even maybe sit in a certain position for maybe a minute too long, and then try to recorrect yourself, it will pull it.
Okay, so does it affect like your daily life and daily activity when you do flare up?
I've had to call out of work before for it.
Nothing should be painful. Nothing should be uncomfortable.
Okay.
Since it's your first time ever getting acupuncture and you're on camera, I'm
Yeah.
not going to do anything that's going to make you go like, ah.
Okay.
So we'll keep it pretty simple, pretty easy, pretty straightforward.
Okay.
I am going to tap into certain points. Think of it this way.
Hmm.
Think of each point as a word.
Okay.
And I'm going to use multiple words, multiple points to create a sentence.
Okay.
And that sentence is going to be sent to your brain.
Okay.
And your brain goes, oh, okay, I can do that.
Okay.
So the way the relationship works is that I listen to your body as it tells me what's going on.
Okay.
I come up with the treatment and select certain points that send the message to your brain that say, hey, this is going on inside, so let's make these adjustments.
Oh,
And
wow.
then your brain is the conductor and carries out all of the information and the treatment.
Okay. Wow. I'm excited.
Yeah?
So I could have been fixing myself this whole time, but I'm rebelling.
Yeah. Spleen 6. And this is the medial malleolus. Usually the points, how we find them is we measure them off of certain body parts. So I know that spleen 6, it's going to be about 3 to 4 inches above the medial malleolus in the same line. So I can just hit that medial malleolus and kind of move my finger up, and the point will actually fall into a little divot. I can feel it right there. And that's generally how your acupuncturist is going to find a point. And they are on both sides, just like that. And what I do, and the points, there you go. I don't know if the camera can catch that, but that's the first one. Did you feel anything?
I felt a tiny little sensation, but that's all.
Okay.
Yeah, nothing crazy.
Nothing crazy.
No.
Yeah.
Not at all.
Yeah.
It's almost like when you have a mint, you get that little burst of mint.
Oh,
Like,
interesting. That's an interesting way
yeah.
to put it. So a little burst of mint. There you go. Now, just like anything, practitioner to practitioner, it's going to vary. Every
Okay.
practitioner has their own style. There
Okay.
are practitioners who are traditionally trained to be very aggressive with their treatment.
Oh, really? Okay.
What does aggressive treatment look like? They're going to use a fairly thicker gauge acupuncture needle.
Okay.
And their needling technique is going to be more more aggressive. So
Right.
you as the patient is you're gonna feel more
Right. And react more.
and react more. Their school of thought is that no pain, no gain.
Sure.
The more you feel and the more pain that you feel, that means it's working and your body's noticing what's going on.
Okay. I actually have a spontaneous pneumothorax.
Oh, really?
I do, yes.
Would you? How did you?
How did I first discover?
Yeah.
Not to be saddened or anything by this, but when my mother passed away when I was 15, it kind of was induced during a bit of a stressful day at school. And that's what happens, especially in thin males. It can be very stress induced and just kind of took me down. And I've had a few since then, maybe 2 or 3 occurrences where I've had to go to the hospital for it, but I haven't had to have anything surgically rectified yet.
Okay. Good. Good. These feeling okay so far?
Yeah, totally.
Awesome. So we're going to get these in. And then what we're going to do, Max, is I'm going to connect some of these points to a little machine.
Okay.
And with that machine, it's going to send a very gentle electrical impulse into these points back here.
Oh, interesting.
And that impulse gets the muscles to relax even more.
Okay.
So nothing should be painful, nothing should be uncomfortable. But I'm going to attach this little machine. We'll get it all on camera so you can see it.
Yeah, cool. I'm excited.
You can see it when it's all done and ready.
It's almost like a science experiment.
Yeah, they kind of look like jumper cables. Full or uncomfortable?
No, not at all.
Okay, awesome.
It was really interesting.
Interesting sensations?
Yeah, it's interesting because the side that hurts the most was vibrating more than the other side, I felt like.
Gotcha.
Yeah.
Gotcha. And which side? You're usually on your right side, right?
It's actually my left
Left
side.
side?
Yeah.
Okay.
I mean, it's usually both, but the left side will pull harder.
The first one you're going to feel is there.
Okay.
And you're just going to feel a little suction there.
Okay.
If it's too tight or uncomfortable, just let me know.
Oh, okay. Wow, that was interesting.
Second one is going to be on that side. And same thing, if it's too tight or uncomfortable,
Okay,
let me
cool.
know. So I'm going to slide some of these down.
Okay.
And you're going to see how that feels. And you may feel it pulling or a little uncomfortable. How's that?
Yeah, that was good.
And you'll see with the camera, even just a few seconds on the back, he's already getting some red circles there. Those red circles, they'll stay there anywhere from a day to maybe a few days.
Okay. No bikini shoots for me then.
And you'll notice up here, they're a little darker. Darker like that indicates blood was not moving through this area as efficiently or as freely. So this is also helping his circulation through the back. And even moving up a little higher, you'll see through here that they're pretty dark. But that's good. It's indicating that this was definitely needed for you.
Yeah, for sure. It feels, honestly, just these couple seconds feel like a relief I've never expected.
Wow. Already?
Yeah, already.
Okay. Cool. Yeah, you're going to feel a lot looser and a lot better. So I'm excited about that.
Yeah.
Again, if it's too much or uncomfortable, just let me know.
Okay, thank you, doctor.
Yeah. This one's a little tight, so I'm going to let some air out of there.
Okay.
You get those funny noises every once in a while.
Where does this practice come from?
It actually originated in India.
Oh, okay. Interesting.
And then China kind of took it and created their own version, marketed it very well as Chinese medicine.
Oh, wow.
And the world knows it as that now.
That's definitely where I would have thought it would have come from, but that's so interesting to find out that it's from India.
Yeah.